Last week we had an unprecedented event. The chairman of the Federal Reserve Board gave a news conference, and one of the issues that came up was the federal budget deficit and the long-term fiscal outlook. And Chairman Bernanke reiterated, as he has on previous occasions, that indeed we do have an unsustainable fiscal situation. It's important for Congress and the President to address that sooner rather than later. He didn't get into specifics. He didn't make any recommendations about how they do it. Diane, you've been looking at that question, and one of the important things that comes up is the mix of taxes and spending. How much you would want to cut spending and when, and what would you want to do about revenues. And part of the problem in looking at solutions is people get fixated on historical averages, and you've looked a little bit at that, particularly with revenues. What
yeah, so I recently wrote an op-ed column for Bloomberg Government, and in it I was focused on the Republicans' pledge to keep revenues at 18 to 19% of GDP or below. If you look at all the promising ideas for bipartisanship on deficit reduction, if you look at the President's own Fiscal Commission's recommendations, if you look at the Bipartisan Policy Center's recommendations, the Rivlin-Domenici Task Force, if you look at any of these bipartisan plans that have been developed in this town, they all involve a mix of both spending reduction and revenue increases. Whether we're able to get sitting politicians to agree on a mix of both revenue increases and spending cuts really depends on whether we can get Republicans to look at tax policy a little bit more broadly than focusing on the historical average of revenues as a share of GDP. If you look at Senator Coburn's an example of a Republican who has recognized that tax expenditures are spending programs and that they grow government rather than shrink.
I thought that was one of the but one of the main policy recommendations to come out of the Bowles-Simpson and the Rivlin-Domenici group was that you could get a lot of revenues at lower rates. So you'd have a more efficient tax system, a simpler tax system, and you'd get higher revenues.
That's right.
And I think, one of the things when you were talking about the historic level of revenues versus spending is, if you look at the spending side, Medicare, Social Security, Medicaid, they are projected to grow for a number of reasons, but primarily because they're going to be more beneficiaries. And then you look at the healthcare programs and its rising healthcare costs. Even if you accept all the savings from last year's Affordable Health Care Act, you are going to get those three programs are going to cost a lot more in the future. So, to me, I look at that and say, even with great effort to control the spending growth there, they're going to cost more. And so that gives us a choice as looking at a budget. You can either cut back the rest of government significantly or raise revenue above its historic average, or do something to constrain the growth of the entitlement programs. And I think you're going to have to do a combination of all of those things. So, I think it's just important that people not look at growing costs and say, gee, this is just big government gone wild or waste, fraud, and abuse. It's the important spending driver are those three programs, which are inevitably going to cost more than the historic average, just because of demographic changes.
And the choice is, if we're not willing to raise revenues as a share of GDP, which, by the way, 18 to 19% was not even sufficient to keep up with 40-year historical
spending
average.
has been about 21%
exactly.
of GDP. So we've historically had this about 2.5% to 3% deficit, which could be sustainable if your economy is growing that much each year.
And if we're not willing to cut the spending side, which it's very difficult, even if we were willing to do so, we're going to have to turn to revenue increases.
Yeah, and that happened under both plans, the Rivlin-Domenici and
exactly.
Bowles-Simpson plan.